Dr. Wallace. In India, we were still, at a space where transgender health was something that was done in Bangkok. Not something that is a part of, what normally happens in our hospitals, because our hospitals are still battling with infections, and really in the public sector, transgender health is not a subject which anybody talks about. There are no role models. There are no postgraduate courses. There's in fact nobody that if I as a medical student would want to pursue in a government hospital, so to say, I would never see somebody practicing transgender health. We might have some people who would be faced with this issue, probably with neonatologists when they talk about ambiguous genitalia, and maybe later with pediatric endocrinologists when they would talk about precocious puberty. But then that's about it, And yes, pediatric surgeons may be operating some, interesting cases, so to say. But transgender health, as such, is really something which is not known. So my first question to you, or rather, the lead to you would be to, just take us through this journey that about the gender development, and a little bit about how does one land up in gender dysphoria, and what is all this about?
Thank you for having me. I think definitely is like, in terms of providing care for children, especially if they will present with some gender identity concern, I think it's very important to work with multidisciplinary team. So I think that relying on a medical doctor team to provide part of the care for the kid with gender dysphoria or gender identity concern is important. But also, like I think I noticed other people say, the school part is also important. The parent education is important. The psychological mental health department is also should be part of it, to work together to provide a collaborative care to help the gender diverse community. I think that would be the more ideal way to approach this. In terms of children, they come to us. I think we see as early as like 2 years old, they will, for some severe gender identity concern, will show up at our office. I happen to work also at the government office providing mental health. So as early as 2-3 years old, they will come to us. And have given in mind, so children, they tend to learn about the gender identity as early as 2 or 3 years old. And for those who have severe gender dysphoria, that may be the time that they may disclose some discomfort to their parents in terms of about see their gender identity and their sex not quite alike together. But however, because they're still children, we still try to provide care and support so that we can able to see how they develop. So the most important thing is always the persistent, insistent, and consistent. We just want to see how those gender identity concerns able to persistent, consistent into the puberty. Along the way, how we can provide support to help them to affirm their gender identity, learn about themselves, explore their gender identity, and be able to consolidate their gender identity.
Thank you so much. So the catchword is persistent and consistent. And I think that's a very important message for the pediatricians, especially the ones who monitor development. Development pediatrics is something which is coming up in a very big way in our country too. So while on this thing, could you just elaborate if there are any other red flags that one should, be looking at? And why I talk about red flags is because in our country, the pediatrician's office is quite busy. They end up seeing 40 plus cases on a daily basis. So could you just educate us about the red flags?
Mm-hmm. I think that in terms of red flags, I think when the kid displays with gender identity concern, I think the most important thing is have the parents and have the finding out how would be the best way to provide care and support their kid. Because if not being well supported, a lot of time, this is the time then that the kid will develop a sense of feeling inferior. Very fast, the kids will learn that the society expects certain gender behavior to be present, or gender um, conforming ways to be normal. So very important that early on, I think it's important to have the parents to be able to get the education and be able to get the provide support for the kids. That will be important, because down the road, if not, then the kid will tend to have lower self-esteem, may have some anxiety issues, may have depression, may have social anxiety, and so on, different mental health, which can be minimized or even prevent if we're able to provide adequate care and support for the kids early on. And of course, some of the kids, they may be comorbid with other issues. I think we can talk about it down the road. But I think the most important is able to identify the concern of the kid and be able to get the help that you need and the education that you need, so that we can provide evidence-based care, and then be able to have best support for the kid. And that would be the ideal.
So what I'm hearing is that this is something which requires probably a team effort to come in, and the pediatrician to be aware and look at the child, listen to the child, and look what the child is doing in their pretend play, look what the preferences are, respect them, and probably take the parents to also understand that these are issues which are perfectly normal, and we would be requiring a team approach to handle them properly. So when we talk about the pediatricians, when do you see the pediatrician to start shouting out for other specialists to come in? When would you want the primary care provider to activate the whole team as such?
Mm-hmm. I think a lot of times that when the parents seek out precision and seek out care and support from them, a lot of the time that the doctor will referring the clients to us right away, and so that we can able to work collaborative together. A lot of times that we will do the assessment and just to find out how to best support the kid and any other comorbid issues going on, and then we were able to provide assessment report to the doctor, and the doctor will have some ideas from the psychological mental health point of view, how can they also help support the kid, so that we can work together to provide information for the parents and the child, how to help them to address the gender identity concern and foster healthy development, so that the kid be able to learn about who they are and have a consolidated gender identity. And that will be ideal to work collaborative together. Of course, the prevention care is always the best care. Work together as a team with other disciplines will be, I believe, is the best way to provide care and support for the family as well as for the kids.
There's another dialogue that we are hearing, and there's so much of talk about linkages of autism with gender issues. So this is something which we are. I'm sure all pediatricians are so curious about, and who best to answer than you? Could you throw some light on this?
Yes, and that which is very true. We do find more gender dysphoria, kids with gender dysphoria, they tend to have some signs of autism, and they tend to have maybe higher percentages than other kids who doesn't have it. Having said that, I think it's important to highlight that just the kid happen to be autistic, it doesn't mean the kid, they don't know about their gender identity. They still do. But the way is they deal with it, the way they express it and communicate with us will be slightly different than kids who are not on the spectrum. So I think that's very important for parents to know, because a lot of times they think, because my kid have on the spectrum, autism spectrum, my kid may not know about their gender identity, and which is not true, because they still have a sense who they are. and what they are inside. The only way is for them to figure out and to express that and communicate with it and deal with it is sometimes is more challenges than kids who are not on the spectrum. For example, the social interaction. A lot of times that they may have reading social cues and social rules a little bit more challenging for them. So learning how to be a gender minority and be able to communicate with other people and interact with peers who are maybe not understand what my gender identity is can be challenging for kids who already had that deficit to start on. And some of them, maybe they also have some sensory issues. So having that sensory issues, so having them to attend the group to learn about who they are sometimes may not be ideal because they're so easily be overwhelmed by noise, by big crowd. So we have to find a way to help them to consolidate the gender identity, learn about themselves in a more unique and personalized care plan for them, rather than the cookie cutter. This is you because your gender dysphoria, therefore you do A and B and C. That may be good for some, but may not be the best approach for kids who happen to be on the spectrum, who also happens to be transgender.
Thank you for that insight. And so what essentially one has to be, aware of what is happening in other fields and how it does relate to children. And children, when we look at any child who walks into our clinic, I think as we measure the height, the weight, and the vitals, we should also be doing a little bit of monitoring as to where does this child stand on the psychosexual social development stage. And probably this is something which should come into our teaching and clinical practice. Your comments on that?
Okay, I think that the question is, I don't quite get the question. One more time, sorry.
Yeah, so actually to put it simply is that, is there a need for each and every pediatrician to also monitor gender and give it the same kind of importance as it would give to weight of the child?
Yes, I think that is very, not just for physician, I think it's for all the medical doctor who is learn about gender and gender identity and other sexuality of children and youth. I think sometimes, sometimes the parent will take the kid to see pediatrician, but sometimes the kids may be on crisis, they will take the kids to emergency room. Right. So I think the doctor should be starting on have that kind of knowledge to anybody can come to your door with gender identity concern, with sexuality concern. And especially if doctor being able to identify some of the early signs and be comfortable asking those questions, that would be important. And especially children, we don't think about children also have feelings about sexuality and gender identity. And I think that able to have being sensitive and read some of the signs and be able to ask the question, feel comfortable to explain those to the parents will be crucial, because sometimes the sign can be quite subtle. And then be able to read those signs and be able to understand what's going on and be able to provide education and preventive care for the parents and for the youth that can go a long way and prevent a lot of unnecessary mental health and any crisis from happening down the road.